Now, as promised, the latest study about berberine. A new study from China looked at a compound that's called berberine ursodeoxycholate, and researchers in this study enrolled 100 adults with type 2 diabetes who were not getting good results from diet and exercise. Their average age was 54, and 36% of them were women. One of the measured parameters was hemoglobin A1C, that is a blood test that reflects the glucose level over 3 months. It's an important value in general for monitoring diabetes. For these participants, their A1C was between 7 to 11, and that's not good at all, as the normal value should be less than 5.7. For 12 weeks, these participants were divided in three groups. The first group got a placebo. The second group took a low dose of berberine, and the third group took a high dose. The results were very interesting. The group that received a high berberine dose saw the biggest improvement. Their average hemoglobin A1C dropped by 0.7%, and also in half of them, this hemoglobin A1C dropped below 7%. Fasting glucose levels also dropped significantly, and even cholesterol and liver enzymes level were improved. Best of all, the treatment was well tolerated. So what does it mean? Berberine-based supplements may become very helpful natural addition to current diabetes treatments, possibly boosting adherence, compliance of patients because it's a safe option to help them manage their blood sugar. But keep in mind, in this particular study, it only lasted 12 weeks and it was limited to one population group. So we need more research to know the long-term benefits and effects of berberine across different ethnicities as well. So my final thoughts. Berberine is one of the most exciting natural tools we have nowadays to support your body's ability to balance blood sugar, fight inflammation, and age more gracefully. But, like I always say to my patients with everything, it's not a quick fix. In the right context, with the right guidance, it can be incredibly effective, and it's actually in our protocol for gut health, for metabolic syndrome and prediabetes, functional medicine approach, and etc. So it's a wonderful, wonderful natural supplements, but again, everything has to be done correctly with moderation. So please consult your doctor before starting it in at any dosages.